Hello everyone. This video will be helpful for you to understand regarding the term midwifery-led care units. So I'll try to explain the term midwifery-led care unit under the following topics: introduction, definition, aims, objectives, competences, models of care, and roles and responsibilities of midwifery group practice. The term midwifery group practice and midwifery-led care units are all the same. So to see the introduction, a midwife, who is a midwife? A midwife is a trained health professional who helps women to be healthy during labor, delivery, and birth of babies. Definition. Midwife is the lead professional. So she'll be providing continuity of care during the planning, organization, and delivery of care given to a woman from initial booking to the postnatal period. So there may be hundreds of women coming to the outpatient department. So here the midwife plays a lead professional role. What she's playing, whoever it is coming, she'll remember all the mother by name and she'll give a continuity of care in providing planning, organization and delivery of care in both antenatal, intranatal and postnatal period from the initial booking to the postnatal period. Aims. So what we try to achieve through this midwifery-led care unit is through the promotion of birth as a natural event for most women. The model of care aims to increase the onset of spontaneous labor and decrease labor interventions. And second aim is to ensure outcome that will result in increased vaginal birth rate, a decreased cesarean section rate, and an increased level of satisfaction for women with regard to their childbearing journey. So these are the two main aims of midwifery-led care units. Now see the objectives. The provision of balanced and consistent information for women and their families, provide care and facilities which are aligned with the woman's unique pregnancy and birthing journey and their subsequent transition to parenting, to provide an option for midwifery evidence-based practice in promoting optimal maternal and neonatal outcomes. Continued objectives continued here to promote women's satisfaction during pregnancy and childbirth through collaborative participation in decision making, to offer pregnant birthing women a choice of service, to provide continuity of care by a node midwife with a dedicated group, to implement an affordable and sustainable model of maternity care within the current budget. So these are the objectives of midwifery-led care units. Now we'll see the competencies. What are the skills and knowledge that are essential for this midwifery care practice, and the women who are working in midwifery-led care units are called the MGPs, midwifery group practice. So what are the competencies required for them? They should be able to provide respectful maternity and newborn care to all women and newborns, provide continuity of care for mother and newborn, conduct antenatal clinics and counseling, perform triaging in collaboration with the obstetrician, promote and manage physiological normal births. This is the competencies one. And it's continued. Identify complications, provide emergency care based on established protocols and refer. Provide RMNC health services, that is reproductive and maternal child health services. Stay by a soon-to-be mother's side through the labor and childbirth process. Look for complications or situations where a medical doctor is required. Educate a woman on birth options and their unique health issues. Prepare mother for what to do during labor, childbirth and postpartum. Teach a mother how to breastfeed, care for the infant and mentor the other team members. So this is the competencies one. Next is the competency two. Pre-pregnancy and antenatal care. Here, the trained staff nurse as midwife should provide high quality, culturally sensitive health education and services to all in the community in order to promote healthy family life, planned pregnancies, and positive parenting. The staff nurse should provide high quality antenatal care to maximize health during pregnancy. That includes early detection and treatment or referral of selected complications. Competency 3. Here the staff nurse as midwife should provide high quality culturally and promote physiological labor and childbirth. They should manage sensitive care during labor, save spontaneous vaginal birth and prevent complications, and provide care to the newborn immediately after birth. Competency 4. Ongoing care of mother and newborn. The staff nurse as midwife should provide comprehensive, high quality, culturally sensitive postnatal care for healthy women, healthy newborn infant. They should promote breastfeeding, detect and treat postnatal complications, and manage the problems in newborn infants. They will ensure that unless there are contradictions, the mother has skin to skin contact with her baby immediately after birth and maintains that for as long as she wants. They also provide family planning services. The staff nurse as midwife will work independently and will be supervised. So these are the 4 competencies essential for MGP practice. So basically, during the pre-pregnancy stage, in the antenatal period, the intranatal and the postnatal period, in all the 4 stages, the staff nurse should be able to provide high quality, culturally sensitive care to the woman and her baby, and she should be able to detect the complication at the earliest and refer to the doctors as necessary. Okay. Next, we'll see about the models of midwifery care-led care units. What are the models? Team midwifery and caseload midwifery. Under team midwifery, here they aim to provide continuity of care to a defined group of women through a team of midwives, sharing a caseload often called team midwifery. Thus, a woman will receive her care from a number of midwives in the team, the size of which can vary. Next model of care is the caseload midwifery, where here aim to offer greater relationship continuity over time by ensuring that a childbearing woman receives her antenatal, intranatal, and postnatal care from one midwife or his or her practice partner. So you see, there's a basic difference here. The number of midwives caring for a woman is many in team midwifery, where in caseload midwifery, it's only a one midwife, and they'll make sure there is continuity over a time, continuity of care over a time period, that is from antenatal, intranatal, and postnatal care given by one single midwife. Next, we'll see about the role of MGPs. First is professional development. There is recognition of the increased responsibility, accountability, and competency requirements when midwives become lead carriers with MGP model. All MGP midwives are encouraged and supported to continue their professional development. MGP midwives will demonstrate competencies in the following areas. They should be skilled in current antenatal assessment and care, skilled in promoting and supporting use of water in birth, skilled in promoting and supporting breastfeeding, skilled in promoting and supporting development of parenting capacity, skilled in complementing well mother and baby dischargement and assessments. So the professional development is well encouraged for the midwifery group practice, and also they are expected to have skilled in antenatal assessment, and also has to be skilled in conducting intranatal labor, and also skilled in promoting breastfeeding, that is postnatal care, such as promoting breastfeeding and parenting capacities, development of parenting capacities, and completing the well mother and baby discharge assessments. Next, we'll see the responsibilities of MGPs. Rostering and on call, the MGP midwife will be on 24-hour call during their rostered shifts. When not on duty or on call, the midwife will divert her mobile phone to the on-call MGP midwife. The MGP midwife will attend booking in antenatal, intrapartum care and postnatal visits as required for her caseload of women according to on-call and prior workloads. The scheduled visits that cannot be arranged for another time will be provided by the next available. So whoever is on the on-call duty, that MGP midwife will attend all these responsibilities like booking in antenatal care, intrapartum care and postnatal visits. So antenatal care, what are the care it's given during the antenatal care by the MGPs is they will organize a consultation with the senior obstetrician or obstetric staff specialist for MGP women if medical management is required. On discharge from antenatal ward, the management plan will indicate the lead care, then schedule the planned visits and ongoing collaborative care will be between the woman and MGP midwife and the obstetrician staff with a cleared document management care plan. So basically the antenatal care is they will organize the consultation and schedule the planned visits and also they will continue to give ongoing collaborative care. Intranatal care. So how the intranatal care is given? Here the intrapartum care midwives contactable by work mobile. So whoever the MGP midwife who is on call, they are able to we can contact them through their work mobile. So they will intimate the birthing unit and arrange for the meeting at the birthing unit. So they will ask the woman to come to the birthing unit. So if a woman presents to the birthing unit without contacting, then that unit staff will contact the MGP midwife on call. And the midwife will work for a maximum of 12 consecutive hours. Induction and cesarean section, whenever possible, the MGP midwife will conduct pre-induction assessment and consult the senior medical staff. The MGP midwife will retain lead care role unless induction is complicated by a C category risk. The MGP midwife will conduct the pre-induction assessment where possible. The MGP will be available for the woman's care on the day of the LSCs. Postnatal care. In postnatal care, the postnatal discharge is anticipated 4 to 6 hours after birth. The referral guidelines for postnatal care will be utilized for determining the clinical risk. MGP discharge planning will be undertaken by the MGP midwife and the woman. And the MGP postnatal home and or phone visiting is available for up to 7 days with ongoing postnatal contact, parenting and breastfeeding support for 6 weeks postpartum. I hope you gained some knowledge regarding the midwifery-led care unit and midwifery group practice, the definition, aims, objectives, competencies required, models of care, the roles and responsibilities for the midwifery group practice. So we'll see in the next video. Thank you all.